And every 14th of November is World Diabetes Day. The 2025 World theme is Diabetes Across Life Stages, with a focused sub-campaign on diabetes and the workplace. The theme emphasizes a life course approach to diabetes prevention, management and well-being, acknowledging that the condition impacts individuals throughout their entire lives. The sub-campaign highlights the challenges people with diabetes face at work, such as stigma, mental health strain, and productivity loss. And public health physician Dr. Blossom Madwa-Foke joins me to discuss the World Diabetes Day. It's good to have you join us at this time.
Good afternoon, and thank you so much for having me.
Right. So let's start with how damaging you think Nigeria's diabetes figures really are, and what do you think they reveal about the state of our public health response?
Okay, thank you so much for that question. So the prevalence of diabetes in Nigeria has steadily been increasing. As far back as 2016, it was about 3.4%. And then a few years ago, it was about 5%. And recent studies have shown that the prevalence of diabetes in Nigeria is up to 7%. That translates to about 14 million people. And bear in mind that worldwide, 500 million people have been diagnosed with diabetes. So 14 million is a huge chunk of that 500 million. So Nigeria bears a huge burden of diabetes, even compared to other parts of the world.
Let's look at how Nigerians are responsible for this. The theme, diabetes across life stages for this year. Are we truly, as a people, really aware that this is a health concern that affects all ages?
When people think about diabetes, people always think it's an older person. So people don't realize that there are different types of diabetes. First of all, there's type 1 diabetes, which usually occurs in children. And there's type 2 diabetes, which typically occurs in adults, but can also occur in younger people. And because diabetes usually at the early stages of the disease tends to be without symptoms, it's sort of almost like a silent killer. So lots of people may even have diabetes or may not realize that they have diabetes because they're not exhibiting symptoms yet. So in Nigeria, for example, where lots of people lack access to healthcare, a lot of individuals with diabetes go undiagnosed. And of course, in that part of the world, even if people have symptoms, they can chalk it off to, oh, it's my enemies, malaria and typhoid. People can't afford healthcare, so they don't even seek help for the symptoms that they do have to actually get diagnosed.
I mean, the cost of healthcare is another major concern. But when people hear about diabetes, some people think it's only about, increase in sugar intake. Are there other factors that really lead to diabetes at whatever stage, even in children?
So like I said earlier, type 1 diabetes, it has a completely different cause. The cells that produce the chemical that helps you to break down your blood sugar, in those cases, those cells are sort of completely destroyed. Now, in type 2 diabetes, which usually occurs in adults, but can also occur in children, there are different risk factors. So there are risk factors that you can't really do anything about, and there are risk factors that you can't do something about. So, for example, risk factors that you can't do anything about include your age. As you get older, your risk for having diabetes increases. If, for example, you have a family history of diabetes, like you have family members with diabetes, you have a higher risk of having diabetes.
Right.
But there are risk factors that you can't do something about, like being overweight or obese is a risk factor for diabetes. Poor nutrition, eating overly processed foods, not eating enough fruits and vegetables, lack of physical activity and exercise. These are all risk factors for diabetes that you can actually do something about.
That's a fine place to leave it for now. Dr. Blossom Madwe-Fokoa, thank you for joining us at this time.
Thank you so much for having me.